The curious case of a lumpy back. This 61-year-old woman was on holiday when her husband, applying sunscreen to her back, noticed a strange growth. No pain, no symptoms, no history of skin cancer. Just one uninvited guest sunbathing on her back. So what do we see? It's a two-part lesion, pinkish at the top, darker at the bottom. Let's break it down using the ABCDE criteria for melanoma. Asymmetry, yep. Border, irregular, colour, at least 2, diameter, more than 5 millimeters, evolving, unknown. That's enough red flags to wonder, is this cancer? Would you refer just in case? Let's bring in the dermatoscope. There are two parts to this lesion, so let's take them one at a time. First, the darker lower half. Anything here to suggest a melanocytic lesion, like a pigment network or aggregated globules? Well, there are some dark globules, but take a closer look. Sharp-edged, irregular, and slightly yellow-brown. These are comedone-like openings, filled with keratin, not melanocytic. As for pigment network, there's some at the edge, but it blends with sun-damaged skin and solar lentigos. The borders are sharply defined. That's more seborrheic keratosis than nevus. And right here you'll see the fissure and ridges pattern in classic Seb-K style. No obvious milia-like cysts under non-polarized light, but this purple homogeneous hue, that's typical for the fused ritty ridges of an acanthotic seborrheic keratosis. Now the upper pinker part, what's going on there? Is this a collision lesion? It's showing soft white keratin projections and dot-like hairpin vessels, textbook features of a wart-like seborrheic keratosis. So what are we looking at? Not a melanoma, not even two separate lesions, just a confused Seb-K with a split personality. Dermoscopy gives us the confidence to say, this isn't cancer, no biopsy needed, just reassurance. In fact, I think it looks like a map of Everest, base camp down here rising into an acanthotic middle tier and ending at the snow-capped summit. So who said dermoscopy was boring? Management? No treatment necessary. Seb-K's never turn cancerous, but if it's itchy or catches on clothing, a quick 30-second liquid nitrogen freeze will flatten this mountain nicely.